Hello. Last week I spoke about the preventer drugs, which are known as controllers, because they control the inflammation due to asthma and also because they prevent attacks. You may remember from the previous episode that the inhaled corticosteroid anti-inflammatory preventer drugs are the main ones that are used to control asthma symptoms and to prevent attacks. Most people with asthma who use inhaled corticosteroid inhalers, as prescribed by their doctor, are able to live a normal life. Now, sadly, those drugs are not available or affordable for many people with asthma, mainly those living in low and middle income countries. There are a number of international organizations that are trying to improve this situation. The other main group of anti-asthma drugs are the reliever drugs, and that's what I'm talking about today. While some of the asthma drugs are in the form of tablets or injections, most asthma drugs are delivered to the lungs by using an inhaler or a puffer, as it is called by some people. The drugs I'm talking about today are all used with an inhaler device. I will talk about the inhalers in another episode. For now, a key message is that the biggest problem with inhalers is that many people cannot use them correctly. So it's really important to ask your doctor or your asthma-trained nurse or your pharmacist to check and watch you using your inhaler to make sure that you're using it correctly. Because if you're not, the drug's not going to get into the place in your lungs where it needs to work. So before we talk about the drugs, there are two things going on in asthma. One is an ongoing or chronic disease which involves inflammation of the air passages in the lungs, and the other involves acute flare-ups or attacks of asthma. The lungs are like big air sacs, and the air passages are very small tubes. The inflammation causes irritation and swelling of the air passages and the tissues around the air passages, and also collection of mucus or phlegm inside those air passages. And from time to time, the inflammation flares up and causes the muscles in the walls of the air passages to become twitchy. So they get tight at times, and as a result, the air passages narrow because these muscles are tightening. And this narrowing is called spasm. And that's what doctors refer to as bronchospasm. Because the air passages are narrowed, it becomes difficult for you to breathe air in and out of your lungs. And also, the narrowing of the air passages causes the wheezing or whistling sound that comes from your chest when you have an asthma flare-up. Very much like pursing your lips to whistle. The anti-inflammatory or preventer drugs deal with all three of those things. The reliever drugs, on the other hand, only treat the spasm or tightening of the walls of the air passages. They work to relax the muscles, and that relieves or reduces the obstruction of the air passages, which allows them to open up again. Now, the medical term for this is called bronchodilation, or opening up of the air passages, which are also called bronchi. So there are two kinds of reliever drugs used in asthma inhalers. These are short-acting and long-acting relievers. The one kind of relievers work very quickly and improve symptoms within minutes. These are usually the blue inhalers, and they do give instant or very quick relief. And that's one of the reasons why so many people become quite dependent on these blue short-acting reliever inhalers, because you get instant relief from using it. However, and this is really the downside, they only work for about 4 hours. And because they only work for a short time, they are called short-acting reliever inhalers. The two chemical names of the most frequently prescribed short-acting relievers are salbutamol, which is also called albuterol in some countries, and the other one is called terbutaline. You can tell which of these have been prescribed for you if you have a look at your inhaler or on the original package or package insert that your inhaler came in. These short-acting relievers are known to doctors as the short-acting bronchodilators, which is also abbreviated to the abbreviation SABA, S-A-B-A. The other downside of these blue short-acting reliever inhalers is that they do not treat the underlying inflammation which is caused by asthma. So they don't prevent attacks. Now these short-acting relievers, which as I say are usually blue, they are really emergency drugs and are used for relief of asthma symptoms. These symptoms are usually cough, wheeze, chest tightness and shortness of breath. And that happens when your asthma flares up or when you have an asthma attack. So if you've been prescribed one of these short-acting reliever inhalers, your doctor or your healthcare provider would tell you when to use it for symptoms. This information is usually included in your self-management plan, which is provided in agreement with your doctor. Okay, so as I said, it's very important to use this blue inhaler when you get symptoms, but it's just as important to recognize that because you need to use that blue inhaler, that's really a danger signal. And when you do need to use this short-acting reliever inhaler, it means that something is going wrong. So let me explain. Remember I said that the aim of asthma treatment is to prevent asthma attacks. So if your preventer treatment is working, and of course I assume that you're taking it as prescribed by your doctor, so if it's working, you shouldn't be having asthma flare-ups or attacks. You shouldn't really be having asthma symptoms. And therefore, if your asthma is controlled, you should not need to use the blue reliever inhaler at all, or certainly not more than once or twice a week. And that's equal to one blue inhaler a year. So a key message really is that if you need to use your blue inhaler for symptoms, use it, but also recognize that this is a potential danger signal. So if you're having difficulty breathing due to asthma, and you've taken your short-acting reliever, it should make you feel better within minutes. And this improvement should last for at least 4 hours. If the inhaler does not make your symptoms better, or if it does make you better, but the relief does not last for more than 4 hours, it's possible that you're having an asthma attack, and you should contact your doctor or asthma-trained nurse for advice or help. Your self-management plan provided by your doctor should instruct you on the necessary action to take in seeking help and in taking medication. So I'll repeat that key message really, and that is that it's important to understand that the blue short-acting reliever inhaler should work to improve your symptoms very quickly, within minutes in fact, and that improvement should last for 4 hours. If this doesn't happen, you might be on your way to having an asthma attack and you should seek medical attention. The other kinds of reliever inhaler drugs are the long-acting reliever inhalers, and these are known to doctors as long-acting bronchodilators or LABAs. Now these long-acting relievers work for more than 4 hours. Some in fact work for 12 to 24 hours, and some work for even longer than that. Now the other thing to know about these long-acting relievers is that in addition to working for at least 12 hours, one of these, and that's the one that's called formoterol, also works very quickly. And in fact, this formoterol long-acting reliever works just as fast as the blue inhalers. And as I mentioned in the episode on inhaled corticosteroids last week, This long-acting reliever is used in combination with inhaled steroids, usually in one single inhaler device, for relief rather than the blue reliever in the so-called SMART treatment regime that I described in episode 4 of this podcast. Now, I do need to point out a safety matter related to the reliever drugs. As I said, the relievers should be used to relieve symptoms as detailed in your self-management plan provided by your doctor. And this relates mainly to the short-acting relievers or to formoterol, the quick-acting, long-acting reliever, which is used in combination with inhaled corticosteroids. However, it is not safe to only take reliever inhalers for asthma without a controller or a preventer. The main reason is that these relievers only work to reduce the spasm or the tightening of the muscles around the air passages. They do not work against the underlying asthma inflammation, and so they do not treat the swelling or irritation caused by the asthma. The long-acting relievers are not licensed for treating asthma without an inhaled corticosteroid. And that's why the long-acting relievers are usually prescribed in a single inhaler that has both inhaled corticosteroids as well as a long-acting reliever. There is another safety matter that I need to tell you about, and this relates to the short-acting relievers in particular, the ones that are usually blue. There's good research evidence that if you use your short-acting reliever regularly and not just occasionally for flare-ups or attacks, then you may be putting yourself or your child at risk of having an attack. And this is because regular use of the blue reliever inhaler can actually irritate the air passages and cause them to tighten. Now, I will talk in more detail in a future episode about the dangers of regular use of the blue short-acting reliever inhaler. It's a very important subject and is causing a lot of worry for asthma experts all over the world. So for now, a key message is that the blue short-acting relievers should not be used regularly, and they should not be used as the only treatment for your asthma. And that's because they don't treat the asthma inflammation that smolders on in the background, and also because regular use can actually cause an asthma attack. So this is something to discuss with your own doctor if you are only using a blue reliever for your asthma. So some of the other key messages so far. In asthma, there's a chronic ongoing irritation of the air passages, and at times that irritation flares up, where the air passages become very twitchy and you have asthma attacks. 3 things happen as a result of these flare-ups. There's swelling in and around the air passages. Secondly, mucus and phlegm collects inside the air passages. And third, there's also spasm or tightening of the muscles. The inhaled corticosteroids and the other anti-inflammatory asthma drugs that I spoke about in the previous episode treat all 3 of these things. However, the reliever inhalers only treat the spasm or tightening of the air passages. They don't treat the inflammation or the other aspects that cause those air passages to block up. So when asthma is out of control due to inflammation, you get symptoms of coughing, wheezing, shortness of breath, and chest tightness. And remember, wheezing is that whistling noise that you hear from your chest when your air passages are tightening. Now, you could get all 4 of these symptoms, or you may only get one. So all of these symptoms need to be taken seriously, and if left without treatment, this can lead to a severe asthma attack. So if you're getting symptoms, take the reliever treatment that you've been advised to take, but also take further advice, because if you're getting symptoms from asthma, it means that your treatment is not controlling your asthma. Your self-management plan, which you agree with your own doctor, will explain which of your inhalers are for ongoing treatment and which are for relief of symptoms. The plan will also explain how to recognize danger and will tell you what to do if you do have a flare-up. I will talk about these asthma self-management plans in a future episode. I hope that in this episode on relievers specifically, together with the previous episode on inhaled corticosteroids, you have a better understanding of some of the drugs that are prescribed for asthma. So in summary, the aim of asthma treatment is to prevent attacks and symptom flare-ups. The anti-inflammatory drugs are the ones that treat the underlying inflammation due to asthma. This is needed to control symptoms and also to prevent flare-ups and attacks. The relievers are intended for treatment only of asthma symptoms and of asthma attacks. So these relievers only treat one aspect of asthma, and that's the spasm or tightening of the muscles around the air passages. And that's the reason why they should not be used alone for treatment of asthma without anti-inflammatory medication, in particular inhaled corticosteroids. Next, ask your prescriber or pharmacist to explain which of your inhalers is for relief of symptoms and which is for controlling your asthma to prevent attacks. The short-acting, usually blue reliever inhalers should give quick relief for breathlessness and should last for at least 4 hours. And if this is not happening, that's a possible danger signal that an attack may follow, and you should therefore follow your asthma self-management plan that's been provided in agreement with your doctor. And if it says you should contact your doctor, then that's what you should do as soon as possible. There is one long-acting reliever inhaler that I mentioned that works very quickly, and that drug is formoterol. And that's prescribed together with an inhaled corticosteroid for regular use and for relief instead of a short-acting blue inhaler. And this is called MART therapy, which stands for maintenance and reliever therapy, which I will discuss in more detail in a future episode. Now finally, because many people cannot use their inhaler correctly, ask your prescriber or pharmacist to watch you using your inhaler to check that you are indeed using it correctly.